And now the systolic is okay, but the diastolic, for example, the people who have 120 by 80 or 140 by 90, but however, if it is greater than 100, 110, 120, the diastolic blood pressure, but this is really serious. But if it is 100, 102, 3, 4, 5, is it okay? It goes to the 110 or 120 is the lower pressure, then that is the very complication to control the diastolic blood pressure. But definitely we will look into that. So large intestine, third point, we just use the LI3 point. One shown according. So we just use the large intestine 3. Do you know LI1? Shangyang, Arjian, Sanjian. Sanjian is LI3 point. We just apply the LI3 point where exactly is located. How to identify that LI3 point? You measure. This is the palmar crease. This is the first palmar crease is this. The first palmar crease is this. The second palmar crease. When the second palmar crease, you just fold it, and then once you fold it, where it get terminated on the medial side, so there is a second head of the metacarpal bone, in the depression. You can find this point to be known as a LI3. So LI3 is the great point. Keep it in the mind whenever there is the diastolic blood pressure is high. So that situation you can use the LI3 point. One or other way will be really useful since it produces the vitamin K. So vitamin K also essential to regulate and then bring down the diastolic blood pressure. So we just applied the large intestine third point.